Hey, it's Steven, your friendly neighborhood anesthesiologist and critical care fellow. Uh, week 2 is down. Made it through another week of crit care fellowship. It was actually pretty good overall. I am still in the Neuro ICU, and this week was a little different. I think the first week I got bounced around a little bit, so I started off in the Neuro ICU, and then I covered Thursday and Friday in the surgical ICU because one of my co-fellows was out with COVID. And so this week, I still didn't spend a full week in the neuro ICU. Monday showed up, went to rounds, everything was good. Tuesday was another good day in the neuro ICU. Wednesday, I actually rounded the neuro ICU and covered the airway pager. So responded to requests for intubation and codes on the floor, along with one of the anesthesiologists and one of the senior residents who was covering the airway pager. So that was interesting. Had a couple of good airways to kind of work through and figure out how to manage. And then I covered call overnight in the cardiothoracic ICU or CTICU. So the way our program is set up, pretty much every month we'll do one overnight call in the cardiothoracic ICU, typically on Wednesday nights. And it just so happens that since I did residency there, the first month, I got two calls. So I'm actually on call 2 weekends or 2 weeknights in the cardiothoracic ICU. So what does that look like? It looks like me rounding in the morning with the team in the neuro ICU, and then about 3 o'clock, 4 o'clock, I went to the cardiothoracic ICU and kind of reviewed the list with one of the attendings and took sign out from one of the residents. So they started signing out at about 4 o'clock and ended up getting out of there around 5. The census wasn't too bad. There was like 12 or 13 patients, a couple of folks coming out of the OR that would have had to kind of admit and make sure they're set up. And then I went and kind of poked around the OR for a little bit and then went back to the ICU to take over. The night was interesting. We did it a lot as a resident. CTICU call is always pretty busy. Hopefully, you can get the patients tucked in. Hopefully, nobody comes out of the OR in bad shape where you have to like massively transfuse overnight or continue to work on. But it was a good night. Um, Stayed up, kind of rounded with all the patients in the unit with the cardiac surgery fellow. There was one like super crazy event that we had to take care of, but it worked out. Patient did okay, and then was just continuously kind of running the list because we have all these patients and there's always things that we need to do. We need to follow up on MRI results and lab results and are they bleeding? What's the chest tube output? So I just kind of continually run the list, and that went on till about midnight, where I kind of had stuff kind of squared away, and then um, still like 1 or 2 in the morning was kind of when I was like, all right, everything's good. Let me go take a nap. And I went and laid down. I just kept like all the pagers and stuff on me because every like 15, 20 minutes I was getting paged for something. Wake up, look at it, take care of whatever it is that needs to be taken care of, and then close my eyes for a little bit. And then I got up at 5 because I wanted to finish updating the list because you got to keep a running list of what's happened and what's been going on overnight. So you got up, was updating that. The day team came in at 6, signed out to them from like 6 o'clock to like 6:15, 6:20 ish. And then I actually went to the OR because there was supposed to be an interesting case from a patient that I had in the surgical ICU that ended up not working out. So then I just went home. And that was my Thursday. Friday, I went back, rounded in the neuro ICU. It was actually pretty good. I got to work a lot with the residents, do a little teaching on how to manage ventilators. It's kind of, I keep forgetting that it is July and this is some of the residents, they're brand new interns. So I was able to teach a little bit about critical care and how to manage ventilator settings. And that was Friday. We had a house staff diversity committee mixer. The great thing about University of Chicago, there's a ton of diversity in a lot of the specialties, and it's a pretty close knit community. So I was able to go and just shoot the breeze with some of the other residents from other departments. It's a very supportive environment. So we'll see what this week holds. I'll be back and forth again from the neuro ICU to the cardiothoracic ICU. Um, Intermittently, kind of in between the McLean Center for Clinical Medical Ethics, they're having their summer intensive. So they are reviewing a lot of the structural groundwork and basis for clinical medical ethics. So as time permits, I'll usually like round in the neuro ICU and then go to some of these ethics lectures to kind of brush up on that. I am a senior fellow this year. So over the course of the year, I'll be covering ethics consults and be able to work with some of the fellows and work with the McLean Center. Hopefully, maybe do some research projects. I don't know. We'll see. It's just really a passion of mine to be involved in clinical medical ethics because we need diversity, we need representation on all of these levels, and medical ethics deals with really tough decisions that are being made. And I want to be in the room and help make those decisions. So that is week 2. So far, so good. Looking at my hair, I guess this will also, you can join me on my lock journey. I've been locked for almost 4 weeks now. That's a whole other story about how I had to like grow my hair as long as I could in the Navy. Uh, there's like hair codes and all that stuff. So it was interesting, but um, yeah, the hair looks good. I'm happy. I'm learning a ton and excited to see what this new week brings. So thanks for joining. Feel free to shoot any questions over. I'm on Instagram, Stephen Bradley MD. If you want to follow the podcast, I do host the Black Doctors podcast. So at Stephen or at the Black Doctors podcast on Instagram, or you can look on Spotify or Apple, wherever you listen to podcasts. And the Black Doctors podcast again shares the stories of minority healthcare professionals with the goal of inspiring that next generation of underrepresented and Black physicians and healthcare workers. So every Monday, there's a new episode that's coming out. This episode is actually hosted by Dr. James Stewart, one of my buddies and co-host. Talks about imposter syndrome, talks about, gives advice for medical students and residents and junior attendings. It's kind of what we try to do, a lot of actionable information from people that have experienced this stuff. So thanks for joining. Again, like this is just a vlog. I'm not really planning on doing a whole lot of editing. It's just going to be like single take. I'm going to figure out this camera. Maybe it won't be so blurry in the future. I don't know. But Stephen, your friendly neighborhood anesthesiologist, signing out.